When Ethan was just 4 years old, his mum, Justine, realised there was a problem with his teeth. They couldn't get an NHS appointment and Ethan ended up in hospital, having most of his teeth extracted.
I felt guilt that I couldn't do anything about it. I felt impotent in terms of reversing it or stopping it from happening. To take your 4-year-old to an emergency dental hospital and be told that the damage is so far gone they all have to be extracted was a shock. And then leaving your 4-year-old on a hospital bed whilst they are being put to sleep to have surgery was devastating.
Ethan is now 19 and says his dental issues caused anguish throughout his childhood.
I remember it was a bit of a nightmare trying to eat different foods that I couldn't eat and could eat, foods that I wanted to eat. But it's self-conscious, I suppose, being the only kid with like 4 teeth.
Lack of access to NHS dentists has been a problem in the region for some time, but the pandemic has made it even worse. Last spring, face-to-face dentistry stopped for 3 months, and they're still working through the backlog. It's seen as a stark example of inequality in society. The fact is that many people simply cannot afford to go private.
The delivery of high quality care is expensive, and we need to make sure that the most disadvantaged in society are able to access NHS care. We need to revise the NHS dental contract because at the moment, instead of addressing oral health inequality, it actually drives inequality.
Soybeans are roughly the shape and size of a child's tooth.
Last year, almost 4,000 children's teeth were extracted in Plymouth under general anaesthetic. A Labour councillor chose an unusual way to illustrate this figure.
If children were having another part of their anatomy routinely removed like this, there would be uproar, but somehow, because it's teeth, we don't seem to mind so much. So the day before the meeting, I spent the day counting out 3,935 soybeans and poured them into a bowl. And it is quite shocking then to see the volume of teeth that are being removed.
A spokesman for NHS England said the key issue affecting access to NHS dentistry is workforce, and we are working closely with partners in Plymouth to increase capacity. For the longer term, we have initiated a dental reform programme to improve oral health and access to dental services across the region. A public consultation, the results of which are expected soon, will help to shape the future of how our teeth are cared for. Sam Blackledge, ITV News.